Welcome back to our program, and we're talking with hematologist, oncologist, Dr. Anup Lal, and we're talking about anemia. Dr. Lal, what are the most common types of anemia?
So like you said, the most common type would be iron deficiency anemia. And while iron deficiency can occur because we are not getting enough iron in our diet, if you have a diet that's very low in iron, that's actually not very common in the States. That is actually a very common problem in other parts of the country, in other parts of the world, I'm sorry, in less developed countries. In the US, iron deficiency due to dietary deficiency is probably not very common. You can get iron deficiency because of absorption problems, because you don't absorb iron properly from the gut due to inflammation or surgeries where part of the gut has been cut out. That's probably not that common either. So the most common iron deficiency would, a reason for iron deficiency would be blood loss of some kind. So as we talked about, the biggest group in this case would be premenopausal women who physiologically have blood losses every month, as well as pregnancies. The other ones would be patients who have losses of blood usually in the bowels for some reason or the other. It could be inflammation, like for ulcer disease or bad acid reflux. Patients who have, we call them arteriovenous malformations. These are little swollen bunches of blood vessels inside the gut, especially the small intestine, which can break open and bleed, and over time can lead to iron deficiency, or polyps in the colon, or diverticulosis, which is like small pouches in the colon, or cancers in the gut. All these can lead to loss of blood also. So basically, iron deficiency anemia, in turn due to blood loss, is probably the most common one that we encounter. As far as other types go, we also deal with other deficiency anemias, which are vitamin deficiencies. The bone marrow needs vitamin B12 and folic acid especially to make red blood cells properly. And if we are low on those, then obviously we can get anemic from that. Again, dietary deficiency of folic acid and B12 is not very common in the United States, but most of those deficiencies occur because of problems with absorption, again due to bowel-related issues, chronic bowel problems, bowel surgeries, and so on.
And that's called vitamin deficiency anemia?
Yes, or nutritional deficiency anemias, nutritional anemias, those are also terms that are used for this condition.
And then you talked in the previous segment about diseases, chronic diseases, cancer that cause anemia. Tell me a little bit more about that.
So anytime you have a chronic ongoing condition that causes inflammation, that can lead to anemia, because inflammation of any kind suppresses the bone marrow and its function, its ability to make blood cells properly. Like hypertension is a chronic condition, but it's not an inflammatory condition, so that's not likely to cause anemia. But let's say if somebody has chronic inflammation from rheumatoid arthritis, or Crohn's disease, or ulcerative colitis, or someone has a non-healing wound on the leg, diabetic patients for example, somebody has chronic gangrene because of poor circulation. So any chronic inflammation, and that's a pretty big group too, because if you imagine the number of people who have all these different kinds of diseases. So any kind of chronic ongoing inflammation will lead to anemia. Now patients who have cancer directly causes suppression of the bone marrow. So you can have anemia of cancer is a distinct entity. In addition, patients with chronic kidney conditions, because like we said, the kidney is the organ that makes erythropoietin, the chemical that helps the bone marrow make red blood cells properly. So people with chronic kidney conditions, which quite a few people with diabetes or chronic hypertension have, they can also get anemic because of that.
What is hemolytic anemia?
Hemolytic anemia is the other category where you don't have a problem with production. The first two categories that we talked about, if you have low iron, that's actually a double-edged or sort of a double whammy, because you have a problem with production. If you have low iron, you can't produce red blood cells properly. Plus, if you have low iron due to blood loss, you're losing cells fast too. The second category, with anemia of inflammation or chronic kidney disease, is a problem with production. Your bone marrow is not making blood properly. The hemolytic anemia is a category where you don't have any trouble with production. If anything, your bone marrow is working harder. But when the cells come out into the blood, instead of living for the 90 to 120 days that they should, for some reason they break down faster than usual. in hemolytic anemias, category is autoimmune or immune hemolytic anemias, where our immune system for some reason thinks that our red blood cells are foreign, like a bacteria or a virus, and starts attacking them and destroying them. The other category of hemolytic anemias are those patients who have certain genetic abnormalities where there is something wrong with the red blood cell or hemoglobin that's being produced, due to which they break down faster than usual.
We've all heard about sickle cell anemia. Can you tell me about that?
So sickle cell is a type of hemolytic anemia because of hemoglobinopathy, meaning a genetically abnormal hemoglobin. So in sickle cell, the hemoglobin that's produced is not normal. So what happens in that case is any time there is deoxygenation or your body is experiences somewhat low oxygen, normally our hemoglobin is able to adjust to that. There are chemical reactions that can cause the hemoglobin to adjust to that situation. In sickle cell, basically what happens is the hemoglobin denatures, or it shrinks up, clumps up, and causes the cell to become distorted. So you get sickle cells. Like if you look at the cell under a microscope, the red blood cell, which is generally fairly circular in shape, it actually looks like a sickle because of the damage that has happened to the hemoglobin. So because the sickle cells are unable to, their sickle cells are abnormal, so they break down faster in the blood. So it's a sort of a hemolytic process because of a genetically abnormal hemoglobin. Another category would be thalassemias, which is the same thing, where you have an abnormal hemoglobin genetically that causes the hemoglobin breaks down or denatures faster, and then as a result affects the mechanism or the inner workings of the cell and causes the red cell to break down faster than usual.
How do you make a diagnosis of anemia?
So the CBC, or complete blood count, is the first step in making the diagnosis, because anemia literally, like we said, means low hemoglobin or low red blood cells. That's where you first see it. You do a CBC and you find somebody has a low hemoglobin. That's your first step. That tells you that you have anemia. Now that starts off the process of finding out what kind of anemia it is and what's causing it. So there are just the CBC can actually give you a lot of information. For example, we look at the hemoglobin, which tells us if you have anemia or not. Then we look at something called the MCV, which tells us the size of the red blood cells. That's helpful, for example, because somebody with iron deficiency will have small red blood cells. Somebody with thalassemia will have small red blood cells too. Somebody with immune hemolytic anemia will have large red blood cells, or somebody with vitamin B12 deficiency will have large red blood cells. So just the CBC itself can give us a lot of information. Similarly, if you see other abnormalities in the CBC, for example, if you see that there is an abnormality in the white blood cells, that could tell us that the patient may have a leukemia or some kind of a bone marrow malignancy or cancer that's causing anemia. So the CBC is the first step, and just looking at the CBC carefully can give us a lot of information to start off with.
We're going to take a break and come back and talk about how do you treat all these anemias.